Okay, right. So clear with the phases. So now I'll be going to the schedule of mock exams, what to be done. I'm not going to keep a heavy tips. I'm going to keep it very simple tips for you, how to approach, how to handle. Okay. So this year for your batch 2023 NEET examination, so we are planning to have more than 25 GTs. Okay, so more than 25 GTs. So as of now, I have given schedule for 25 GTs. Okay, and today we are done with eighth GT also. So till grand examination 8. Okay, examination 8, I have given in the brackets like what subjects I have focused on a particular GT. So GT 1, 2, 3, you have everything. And clearly we have mentioned in the bracket focused on biochemistry. What are the subjects which are included? Okay. If you are not done, do it. Prepare some customized schedule with some modifications according to this, do it. Okay. That is clear, right? You may skip out of 8, you may skip some 3 or 4, you may skip some 2 because you have some personal stuff issues on the particular day, or you may not be clear with the subjects. Okay, but make sure you do them in the sequence, because the grand examinations are prepared in such a way to improve your confidence, and they are linked to 1 to 2 to 3, 3 to 4, for example 8 to 9, 7 to 8. They are prepared in such a way. It is something like how you will learn the basics of dentistry and medicine in the first, second years, followed by the application part in third and fourth year. Can you directly jump into final year without reading first and second year subjects? Can you understand final year directly? Is it possible? Right. Even the grand examinations of MDS Conqueror are prepared in such a way. Okay, because we take lots of time, lots of analysis, lots of things to prepare or come out with a grand examination. It's not like randomly picking something, doing something. Okay, that is not what we do, because we have a clear-cut, proper analysis about why a question, why we are keeping a grand exam, why you have to keep grand exam like this. I have 100% analysis over this, because I sit hours just to come out with a proper analysis, because that is going to help you. It is something like how you read first, second year, followed by third and fourth years. Okay, same. You are skipping 3 and 4, and if you're giving 5, if you're skipping 6, 7, and today's 8, and you're giving 9, your scores will not improve. They may improve, but they don't show drastic improvement. If you're following my commands, at least from now, and give the examinations in a sequence without skipping them, without analyzing them, without following the commands, suggestions given by me, you may not show extraordinary improvement in the scores. You will stay at that at that mean score. But if you want to show some extraordinary improvement in the scores and confidence, you need to follow my suggestions, and you need to implement them and give exams on time and analyze them properly. Right? This is a promise that you're giving me, right? Can I take this promise? Can I take this promise? I want you to respond. This is something like a last war year. Something like Bahubali war, last war, or something like, have you seen 300 movie? English movie is there, 300. Very small, that is a very small kingdom. Very small kingdom. The population is very, very less. Yeah, right. Spartans. So it's something like a 300 movie. Do or die. That's an extraordinary movie, but they will lose the war, but with a pride. Okay. So that is the reason why I'm telling it's like a final war. No more preparations again. I don't want you to come back, conquer, sir. I will again, next year we will join. That next year we will join. After marriage, I will join. After having 2 kids, I will join. No stories. This is the last, do or die. Finish it, get ranks, go join. Okay, right. So this is the plan. And I want, okay, so many of you have promised me, and I strongly believe that you will stand on your words. Okay, so now the plan is, we are already done with 8 examinations along with today's examination. Clear? In these 8 examinations, 4 examinations are module examinations. Right. So these are module examinations, means focusing on 5 subjects or 6 subjects. So 4 examinations are focusing on 5 to 6 subjects each. And there is 1 examination focusing on 3 subjects. You can see them. I'll clearly mention focusing on. And there is 1 examination focusing on 2021, 2020, 2019, 2018 repeats. So how many are done? 4 done, 5 done, 6 done. So the leftover 2 exams are on all subjects. So whenever it is not mentioned in brackets, anything means any question from any corner can come in the exam. So are you clear about these 8 exams? This is very specifically, I'm talking, addressing the people who are not done with these 8 exams. 8 exams, 4 are module exams. I'll give you clearly mentioned in the at the name of the question paper what subjects are included. And one exam is on 3 subjects. And 1 subject is on only repeats of 2021 to 2018, and two GTs are including all the subjects. Okay, right. So clear. So now coming to GT from GT9. So GT9 is exclusively on 2017 repeats. Okay, so this is day after tomorrow. So day after tomorrow, you have GT9. So I want every one of you after this class, go back and start 2017 repeats. So 2017 is basically 8 sessions. 8 sessions are there. Okay. So the exam was done on 8 days. So you have so many questions. Only year where you have so many questions is 2017. 2018 again 240. 2019 240. 2020 240. 2021 240. 22 240. 2017 you have more questions. So it's a good year to revise so many things. For example, in every subject you have minimum 50 to 60 questions. So you are revising 50 to 60 concepts. It's a good revision. So either you can pick 2017 from Neeraj Wadhwan, or if you don't have Neeraj Wadhwan, you can do from Dental Pulse. So after synopsis of every subject, the first NEET repeat starts from 2017, 2018. You have 40-50 questions, do them. So you will have a question paper on exclusively 2017 NEET repeats. 2017 NEET repeats turns to be around 1,000 questions. So you are going to do the 1,000 questions after this class, followed by 22nd you are going to do, that is tomorrow, and followed by 23rd morning you are going to give this exam. This exam will not take more time because you're already very familiar with the questions. Everything is a known question. So clear with 23rd examination? I want your response so that I'll explain what to be done for the next exams. Okay, so 2017 repeats. Okay, it's exclusively 2017 repeats. Okay, then comes the next one. Okay, then comes the next one. So once you're done with exam on 23rd, you have 24th. Okay, 23rd half day will be there. You have 24th is there. 25th is there. 26th is there. Okay, and 27th. Okay, so you have till 27th. You have 2 exams on same things. That is clinical mocks. Clinical mock 1, clinical mock 2. That is your GT10 and GT11. So it's only on the clinical subjects. What are the clinical subjects? 8 subjects which are in the final year, plus your oral pathology, because oral pathology is integrated with oral medicine. So I'm including oral pathology as a clinical subject. I'm not including general medicine and general surgery here. Guys, is it clear? So means after 23rd exam, the next 5 exams, you have to focus exclusively on the clinical questions. All your final year questions plus your oral pathology. Done? Clear? Okay. So logic here is, sir, how we can do that 8 subjects? Sir, 8 subjects are there. How we can do? So most of you are already done with module 4. So how many subjects are included in the module 4? You have your oral radiology included in the module 4. Your perio is included in the module 4. Community is included in the module 4. Ortho is included in the module 4. Pedo is included in the module 4. So most of you are done with, out of these 8 or 9 subjects, you're done with 1, 2, 3, 4, 5. You're done with half of the clinical subjects recently only. Clear? Is it clear? You're done with half of the clinical subjects recently only. So the leftover half you have to do in this upcoming 4 to 5 days. And along with this, you have to give 2 mock exams. That is clinical mock 1 and clinical mock 2. So here, along with these 2 exams, there is one bonus exam. What is that bonus exam? Okay. Just a second. Just a minute. Hope the screen is visible. Okay. So apart from these 2 clinical mock exams, there is one more clinical bonus mock exam, which is present in your mock exam folder in INICET. INICET, you have one clinical mock. Okay. So that you can consider it as a practice, not as testing your knowledge. You can consider that as a practice you can give. So you have one more clinical mock. Okay, for practice. So totally you have 3 clinical mocks, 3 into 240. That's going to turn around 720 questions for your clinical exposure. Done. So once you're done with 27th exam, and after the exam, you analyze the things, you have 28th, 29, 30, 31. Again, you have 4 to 5 days where you can focus on basics. You can focus on basics. So you have basics mock 3, basics mock 4 that can be considered as GT12 and GT13. Along with this, you have one more bonus exam that is present in your INICET, that is basics INICET mock examination. So clear with January. So we are starting February. So February, we are basically jumping into exclusively mock examinations. This mock examination is something like go give exam, analyze the questions where you are going wrong. Okay. Learn something, move to the next one. Give, analyze, move next one. Give, analyze, move. It is something like keep on flowing, keep on giving. So you have 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. And if you require more, I'll try to give you more. Okay. So plan here is, okay, once you're done with basics and once you're done with the clinical mocks, what to be done in the last 1 month is completely customized. It is completely customized to you. How it is completely customized to you? For example, if you ask me, sir, which subject you are weak at? I will tell I am weak at general anatomy because I'm not much focused when I'm reading general anatomy. I never complained that I'm going to weak at pedo. I'm a weak at endo. I'm not going to come. I may be weak at ortho. I may be weak at prostho. Yeah, among the clinical subjects. I may be weak at medicine, not general surgery. I may be weak at physiology, not biochemistry. I may be weak at microbiology, not general pathology. I may be weak at dental histology compared to dental anatomy. Something like that. You have to decide which subject you have to which subject you are weak at. Okay. So you have to give a rating to your subjects and divide the subjects into 2 parts. Subjects which you are strong at, subjects which you are weak at. Okay. So there is 2 methods of reading here. Like for example, going to the, reading all these things, the wrong answers is one method. Okay. And what you are going to do on February 1st, so that you are going to give a mock examination on February 2nd. Okay. You are going to give a mock exam February 2nd. What to be done on February 1st? So in this, you have to pick some weak subject, which you really believe that you are weak at. So I strongly recommend all of you, don't always go to pharmacology. Don't tell pharmacology weak at, I'll read pharmacology. You keep on reading pharmacology will not give scoring. So decide a combination of subjects. So every day you have to touch 4 subjects. So if you are, for example, reading 12 hours a day, so split your day into parts. What are they? 3 hours. 3 hours, 3 hours, 3 hours. So make sure you read 1 subject in 3 hours, 1 subject in 3 hours, 1 subject in 3 hours, 1 subject in 3 hours. And make sure don't read entire subject. Sir, how I can finish entire subject in 3 hours? I am asking you to read where you are weak at. Where you are weak at. For example, if you're reading endo, I'm not weak at apexification, apexogenesis, pulp cappings, and all these regenerative everything. I can answer those questions. I am weak at classifications. I am weak at numbers. So such things I'm going to identify and I'm going to read them from endo. Or for example, if it's operative dentistry, I'm going to read something. Like biochemistry, I'm going to read PP books, go back, revise the PP books and come back. And followed by giving GT 14, that is your mock examination 5. Mock examination 5 is going to tell you where you are weak at. It's going to point, Aray Baba, you are weak at this place. Now, 2 or 3 questions came from anemias, you lost. So it is going to indirectly tell you that go back after the exam, read anemias. Go back after the exam, read some part of general medicine. That part is anemia. That part of physiology, that part is anemia. So it's going to tell you where you are weak at, means a topic you are weak in a particular subject. Or if you are not able to decide that, and if your scores are not really extraordinary, then you can go back to checklist to be done for that subject or for a group of subjects. Clear? Is it clear? Checklist we have already discussed. We have started the session with the checklist itself. Clear? I'm very happy. I told 300 movie, exactly 300 students are there online. Okay, it's wonderful. Hopefully we'll give a good fight this 2023 NEET examination. Okay, so now if you ask me, so in this session, this again, the session will be uploaded as a recorded version, not on the YouTube channel. It will be uploaded on the website, okay, in your quick revision folder, okay, in 2 video sessions. So what I have discussed in the session, first one is checklist to be done. If you are not on track and if you are not scoring more than 500, still fighting in 300s, 400s, okay, not hitting that 500 mark, this is the checklist that you have to finish first. Okay, next one, how to solve these mock examinations. This is how you have to keep a book and you have to solve the mock examinations. The third one, what to be done, the principles for negative marking. Okay, so I have discussed about 4 principles. Try to do that, try to apply that 4 principles. Next, how many phases your final exam has to be done or your regular mock examinations has to be done. These are the 2 phases. Third phase is an accessory phase. And this is the schedule, okay, for your mock examinations and everything. Now, if you have any doubts, you can ask me. I'll try to give a simple answer. I don't want to make things complicated because we are already in a complicated situation. So I don't want to add any more complications. So let's have a positive, funny, stress-free talk for the next 15 to 20 minutes. If you have anything in your mind, you're open to post it on the chat box in personal or openly, or you can post it to my WhatsApp. Now, part A, part B, don't differentiate like that. Okay, so whatever you feel comfortable, you proceed. I don't want to incline myself to one area, because last day I was talking to the toppers. Most of the students from other institutes, they were telling that the part A is so difficult, but MDS Conquer students coming out and telling that the part A is so easy for them, because we focus more on part A during the revision schedule. So they feel more comfortable with part A. So I don't want to differentiate part A and part B. So whatever you are comfortable, you can proceed with that particular part. So no particular discrimination I want to give. Sir, for today's exam, what is the optimum score? The today's exam optimum score, anything above 500, 550, yes, it's good according to me. Basic mocks are on other than the clinical subject. Yes, I told clinical subjects are all 8 subjects plus your oral pathology. So basics are including on first year, second year, and third year subjects of general medicine and general surgery. Where are the repeats of 2017? Dental Pulse. Dental Pulse, after every subject, they have clearly mentioned NEET repeats 2017, 2018. Every subject is having. How to mail DCA regarding the internship? Already completed. That is not question to be posted here. Last few days should be revising everything like image basis. or some concepts focusing on the last 5 years. You are doing repeats every day. You are doing repeats on the website. So don't specify yourself what to be done on a process in these 38 days. Once you start the preparation seriously, the preparation only will tell what to be done. So yesterday I have given you a checklist of 50. I have given a checklist of 50. Okay. I don't know how many of you added few more checklists to this. So this checklist has to be done in the last 5 days. These checklists, we keep on adding the topics to the checklist and those has to be done. What will be included in the basics? Already covered. Few days ago, Sahiti ma'am told to split the day and read strong and weak subjects simultaneously till February 1st. Shall we read what is necessary for GTs, or GTs are on grand examinations? Means GTs are going to cover all the subjects. Whatever Sahiti ma'am told and whatever I told is same. GT means it's focusing on all the subjects. So you have to read everything. Look, the methodology of reading is identifying the weak topic and reading is one methodology, or identifying assuming that entire subject you are weak and reading the entire subject is one methodology. So what I strongly believe is no one is going to be weak in a subject. People are going to be weak in a particular topic, in a particular number of topics in a subject. No one is weak in all the topics in all the subjects. Yeah. So you may be weak in a particular topic or a particular concept in a particular subject. So my suggestion is rather than reading the entire subject, I'm asking you to hold the topics, be strong in the topics. For example, you have your room freshly washed and there is some ink or something which is splitted at a particular area. Now you are going to clean the entire room, or you are going to clean that particular area only. My suggestion is clean that particular area because we don't have time to clean the entire room. So identify those areas and read them. I don't give previous mock examination. Should I continue with upcoming mock, or should I start from the grand examination one? So my suggestion is you try to do the things simultaneously. You try to finish the previous ones also in the alternative days. Okay. It's not about scoring, it's about learning the concepts which are important. The concepts will be repeated in the upcoming grand examinations in a different format. Okay. Thereby, if you get good scores in the grand examinations, your confidence will be increased. So it is going to indirectly play with the concepts as well as your confidence. So that is the reason why the sequence is important. During this last 30 days, should I read the synopsis for every subject, as I'm not able to recollect it? Kuldeep, I have given you the checklist to be done. Okay. First, you finish this checklist. Once you're done with the checklist, okay, and once you're fine with the checklist, we'll decide what to be done next. First, I want you to finish this, where you will upload this recorded version. We'll discuss about that. Any tips to revise basics and how to be accurate? Revision is going every day. Revision is growing on everything possible on the group. Same checklist. I want you to go to the checklist. How many MCQs should be skipped minimum? We don't have any such theory. Keep posting ranks so that we can analyze where we are in the exam. Yes, of course, but you can, in the website, you can check it. You can check it, your rank. What is your rank? You cannot see others' rank, but you know what is your rank, and you can know how many students has attempted that particular question at that time. We should complete untouched subjects first, or just for GTs? How many years we are going to complete untouched subjects? Untouched subjects will be always untouched. That's what I'm telling. There is nothing called as untouched subjects. There is something called as untouched topics in a subject. So identify them and try to do them. Yes. Can you please keep posting checklist topics regularly? It helps to revise the topics that sometimes we miss. Sure, I will do that. Can you please repeat the checklist part which I have missed? You have to check in the recorded. I cannot repeat it now. With the fear of less scoring, don't want to give today's mock exam. You don't want to give only today's mock exam, or you don't want to give the final exam also. Fear factor is there for everyone. Even I have fear factor, whether to keep an exam or not for you. So fear factor keeping fear factor and skipping the exam is a very bad quality, because this is not a final exam. If you have an option of skipping the final exam, everyone will skip the final exam. Okay, right? So think over this. That's a bad quality which you need to change. Sure, I'll post the checklist. Durga, you have to decide what is a bad score. I have given an optimum score for this paper. 440 for your preparation. If you feel bad score, then you should come and talk with the mentors how to improve it. I have already told what to be done to improve your scores on the video. In the grand test, how to keep environment like main exam. Go to a net center nearby and try to give exam. You try to give an exam preferably in a new area. Then you are going to create that environment. You are comfortably sitting in your home, in your place, in your institute, where every day you're being exposed. That you cannot replicate the final exam environment. Should we read synopsis from Dental Pulse or from PP books? Both. Whatever you have done previously, try to do that. Sir, will the basic exam include all? Basic exam means only basic subjects. First year, second year subjects. In third year subjects, you will have medicine and surgery, general surgery and general medicine. Do the checklist. First, do the checklist. Anyone, first do the checklist. How to avoid negative marking. Already discussed on the video. Next question. Any questions you have, message me on the WhatsApp. Yes, I'll be with you. Don't worry. 24/7, only one job here. No patients, nothing, no family, no friends. Only with you. This 38 days are more important for me rather than for you. Because I'm very, very serious about my students' success. I'm very, very serious about that. I don't know how serious you are, but I'm so serious. I have not given grand examinations till now. Shall I continue with ongoing? This question was already addressed. Yes, recorded version will be kept. That should not be a great doubt here. Actually, I'm getting afraid because I did not touch 7 subjects. You have 38 days. 7 subjects is not a big deal. You can do it. Prepare a schedule, prepare a plan, come out with a plan. You can do it. Yes, this is already addressed. Yeah. Anything I need to please post checks before every GT? Yes, I'll definitely post the checklist. And I'll add this to the 50 topics. Okay, keep on adding to this 50 topics list so that we can revise all these checklists in the last 5 days before the exam. I have been preparing. It's not good, but as I'm confident in subjects and not at all good in other subjects, should I keep focusing on subjects? You split the day into maybe 20 80. Okay, and try to focus 20% of time on the subjects which you are not confident at, and the rest of 80% you can follow the group schedule. What is the time limit we should allocate? Each question, there is no time limit. That's what I have discussed the questions in phase 1 and phase 2. So phase 1 questions will be done fast. Phase 2, phase 3 questions will take time. So no, there's no time limit for each and every question. Most welcome. Motivation is enough for preparation. Yes, I'll be there. It should be like a movie, or like a Bahubali or a KGF Part 2, or probably Pushpa 2 that is coming. We are going to rock. I'm very confident. Can I completely leave community? Which community? Conquer community? No, you should never leave a subject here. This requires a balanced preparation, and community is one of the loving subject. Why should you leave community? Community is easy. You can do it. Can you please repeat how to prepare for mock exams again briefly? There is a network issue. Recorded version will be uploaded. You can see that. Is it okay to leave 40 questions in the exam? I have discussed that how many questions you have to leave basing upon your preparation. 40 questions to leave an exam is not an open question that I should answer addressing all the students. So it varies with the preparation level. I'm losing marks in the wrong MCQs. What should I do? You have to correct. You have to revise and you have to improve the right answers. The answer is there itself. I'm losing marks in wrong questions. Right, mark them right. So you'll get that marks. I have discussed about the negative marking. Please do check it. The subjects which I did not finish, should I read from synopsis or learn from the videos? Both. What topics should be done? Microbiology is very simple. Yeah, it contains sterilization, immunology, and it contains bacteriology, virology, mycology, parasitology. So it's only 5 topics. So you decide the 5. There will be like 8 bacteria which are important, 4 viruses which are important, 3 fungus which are important, 3 parasitology which are important. Even after revising, why you are not able to answer question? You should answer it. You should answer it. If you are not answering even after revising, there is some problem with the preparation. For that, you need to talk with your mentor personally. Can you please repeat how to prepare for mock exams briefly? Aishwarya, I'm going to upload this recorded version here. Again, I can't waste my time like 20-25 minutes. I can't waste on repeating the things which are already done exclusively for you because of your issue with the network. I'll upload this recorded version. You check it off. Follow the instructions what I have given for negative marking. So the negative marking will be reduced, Shivani. I have discussed 4 golden principles that you have to apply for the negative marking from now. You try to implement those things and try to get back to me with the feedbacks. Most welcome, Sujana. Most welcome, Arpita. Anything more? Yes, you can go. Already 80 people have left the session. I'm just trying to address the issues because everyone cannot access me. They have a fear factor of exam. They have fear factor of Srikanth sir also. I don't know. Do I look very cruel? Do I look very harsh? People are scared to talk with me. Max related questions you can ignore, yeah. Max related questions you can ignore. Don't worry. So no need to scare. I'm not into academics. I don't influence any of your future teachers to screw your lives. I'm not really interested. I'm here to help you out. Okay. So you're always welcome to message me, call me. Only related to the subject. Huh? Subject or preparation. Recent advances, yeah, we will be doing here. We are working on this within our limitations, whatever that is going to come according to the mentors of the individual subject. We are going to discuss the latest things. Don't worry, everything will come in mock exams on time, for sure. Yes, now it is 167 students. Any further things? Personal things, maybe issues in your family, XYZ factors and all these things, we can discuss on phone or on the on WhatsApp. Okay, so I'll be there. Don't worry. The thing is, I'm committed to this. I'll be there with you till the date you go to the examination hall. I'll be helping you at my best. That is for sure. Me and my team are so dedicated. They're working so hard. So we are going to provide you the best things. Okay, Chalak, shall we close the session or anything, any more things to address? Okay, guys, we'll meet again probably within 3 or 4 days. Like before we finish January 31st basics exam, we'll be having one more session like this. Okay, addressing few other things. Like basically, it's better I talk frequently with you rather than giving different strategy at a different level. So I don't have any plans of giving a different strategy. This is the final strategy that you have to follow. But frequently, I'll try to interact with you, talk to you, motivate you. Okay, bye, take care, study well.